midwives are really indispensable. I think I'm beginning to agree that without midwives, no nation. Let's see, get more from you, IJEOMA.
Our role is that even from when a child is growing up, a girl child, most importantly, you have to let the girl child know that she should take charge of her life. When you give them this step down, they grow into adulthood and they get married. Anything that concerns their life, they will take charge. For instance, a girl child gets pregnant, you come to antenatal ward, we assess you and we tell you you cannot give birth vaginally, you have to be sectioned. The woman should know that, yes, this is my life we are talking about. You will not say, my mother-in-law says this, my father-in-law says that. So the midwife give them that health education and counseling right from when they are teenagers, so that when they grow up, they will stand firm to take their life in their hands.
Okay, well, I think this is very, really important. She has just told us here that the role of a midwife starts even from the girl child, educating the girl child on the importance of her health rights. But I think, can one be a midwife alone?
Yes, one can actually be a midwife alone.
And they will accept you to be working in the hospital.
They will be working, but there are some basic skills that nursing give us,
nursing
or exposure.
You understand? You have to plan from that ladder. When you do a general nursing,
that's why
like midwifery is a specialty.
Okay.
After
It's now area
after your general nursing, they might decide to do your midwifery or go into ophthalmology or dental nursing, psychiatric nursing, etc. So if you decide to go into midwifery, that means you have decided to care for both mother and child. So you have a distinctive role.
That's right.
To play. Apart from that role, you play as a general nurse. So general nursing is the foundation. It's a ladder where you climb before you enter into any specialty.
Okay. Well, they have just told us here that it will be of benefit, really, if you can combine the two. First of all, having the general knowledge of what nursing is all about, and now coming to be in a specialty of midwife. As a midwife, you're a special in that area. You have decided to care for mother and child. That's your infant maternal health and newborn. That's your experience. I want to get your personal experience.
Before I came to FETA, there's an experience I had. The woman, she's a prime mid. You know, during antenatal, you get to check their pelvis.
Okay.
It's adequate. That if the baby can pass through. So after that, the woman was told that you will not pass through vaginal delivery, you have to be sectioned. The woman left and said no. When she left, she said no, that once, because that misconception, that is what we do in health education in Africa. We try to clear all misconception. Most of them will just think that once you are sectioned in the first pregnancy, or the subsequent ones, you will pass through CS. That's not so. There are chances we'll give you to try trial of labor. You try labor. If it fails, then you go for the second one. So the woman left that she wants to give birth on her own. She went to a church. That is one problem we're having, where they will tell them you give birth like Hebrew women, and you forget that
Hebrew women were attended by midwives.
The prayers.
Yeah? They were attended by midwives. You know, people misunderstand this Bible.
So she went there. She was laboring for almost 3 days. At the end, when the baby could not come out, she landed in the hospital, and when she came, she already had IUF. The IUF is intrauterine fetal. The baby was gone already. And after everything, she was sectioned. No life baby. You still pass through the CS, through the pain, through the trauma, through the agony. So she's going home with a dead baby. Something that she would have, if she had cooperated with the counseling given to her, she would have gone with a live baby.
Well, this experience of nurse IJ is typical thing that happens to so many women, especially those ones that are in the rural area, and those ones that believe my pastor said that I will deliver like the women of Hebrew. I don't need to even to go to the hospital. Some even say they don't need to take tablets. In fact, you forgot that the Hebrew women, the Bible you read, were being attended by midwives, because we were told that midwives were sent there to take care of them.
the
And the midwives will help them to deliver their babies. So, and after delivering their babies, they will even tell those people that came, why did you allow this? They say, before we came, they had already delivered. But Bible made us to know that these women, these midwives, were actually aiding these women to deliver. Because a midwife cannot kill a child.
Yeah.
They will rather tell them lies and said, before our arrival, they had already given birth. And when they say that, people now did not read that Bible to understand it deeply, that these midwives were actually the people that helped the Israelite women to deliver safely and without any qualms. But you now will now go back home and now begin to pray. Even when you have, I'm not saying prayer is not good, I pray as well. But the same Bible you read said there is time for everything.
The right thing, you back it up with prayer.
When you do the right thing, you back it up with prayers, not everything. Even the one doctor supposed to do, you're telling doctor that no. Then why did God make a doctor? Why did God make a midwife? Because it's God that gave them this knowledge. Because God wants to save me and you as a woman.
Our work as midwives starts from the antenatal clinics, where they attend the antenatal clinics. So that is where we detect any deviation from normal risk factors. We cancel them. All the health education is done in the antenatal clinics. We encourage them to take their routine drugs so that they will be healthy. Their blood volume will be okay to contain both them and their babies. So that when you follow them up from the antenatal, if there's any risk factor, you let the person know. That is where you detect some ailments and diseases, just like HIV. When you detect it there, cancel them. You can invite their spouses to do the screening too. You enroll them and start the antiretroviral drugs. Because you know there's a possibility of a woman bringing forth a child, a positive woman bringing forth a child that is not infected. Okay, that is where we detect all that deviation from normal. Early detection will save and salvage a lot of things. And when you follow the woman up to the labor ward, you see the woman coming up, hale and hearty, bringing out a live baby, a healthy baby. The woman is happy, the midwives are happy, everybody is happy.
The role of a midwife to the newborn.
Okay? Like my colleague said, once the baby is born, that 1 minute of life, once the baby is out,
it's golden hour.
That 1 minute of life is golden
hour.
If you miss anything within that 1 minute, you're losing a baby. You can imagine a woman carrying pregnancy for 9 months, bringing a live baby, and one thing or the other goes wrong. Woman, you can imagine the trauma, the pain, emotion, everything. So we give our very best in the care of both mother and child. As the woman that delivers, the midwife that delivers to the delivery is attending to the mother to continue management after baby. The other person is taking care of the child. You do, based on what you see, you assess your baby. That's right. The baby. We have a standard method of assessing of babies. We call it ABGA score. When you check the baby's color, the baby is breathing, the baby's respiration, baby's activity, grievance, you check all those things. And we score it over 10, we score it over 10. So if the baby is okay, we don't suction routinely. If the baby is okay, no need to suction, no need to give oxygen, just give that essential newborn care, which includes treatment of the cord. That's what we call IJEOMA. You apply it to the cord, stop. It has antibiotics to prevent infection to the baby. Then feed your baby, wrap your baby well, check for all the things she has seen, make sure if there's extra digits, there are some malformations you look out for, like extra digits. Some people will have another extra digit, okay? You ligate it. When you ligate, they have cut off blood supply. In few days, follow, and the place will be okay. Those are the things you do for the rule.
I think I have to clap for you people. Thank you. You guys are doing great. I'm so impressed. You know, that's why it's good to bring some of these professionals to come to the morning banquet to talk to us. And I believe that from all they have explained to us this morning, we need to hold the midwives at the high esteem. Njema, what's your parting word? What's your advice to our mothers so that as we are celebrating Midwives Day and also to your colleagues,
as mothers, if you are fallen victim of any circumstance, you have to prevent others from making that same mistake. By what? Correcting, educating, counseling. You tell anybody around you that you see that is pregnant, you call the person, advise the person to go to an enhanced facility where we have doctors, nurses, we have specialty. So that any problem you have problem with your heart, the cardiologist see you, you have problem with your skin, dermatologist sees you. So you go to where you have holistic care. To care early dictation, if there is any dictation, they detect early, prompt treatment. When you detect early, you start treatment early, the prognosis is usually very good. For us midwives, you know, it's not easy to handle individual. Different people with different behavior, understand? So when they come with that behavior, like, you just try and calm yourself down. You know that it's just a short time. Especially some people who come in labor, they are agitated, maybe because they are looking for a particular sex. They have girls, they want a boy. When they present already the anger.
Bias and anger.
Anger. So anything you do, please, that, you know. So just try and, you know, it's not easy to handle human beings. Just keep calm. Reassure the woman, all will go well. Ask for her cooperation. It's disabuse any misconceptions as they are coming. They already come with a lot of things. Give them time to, you know, don't ask close-ended questions. Let it be open. You try the question, allow them to answer. From their answers, you know where they are not getting it right. You put it right for them. When they cooperate with you, it makes your work easier. You'll be able to find anything, and then the long and short of everything is bring out a healthy baby. Mother is happy. You too are happy.
What's your own?
My own advice to our mothers is register early. Once you book early, you'll be taken care of. Throughout your antenatal period, you'll be health educated. I will help you to make a proper decision towards childbirth. And at the end, you give birth to a live baby.